Another thing sometimes you'll see people talk about is natural killer cell testing. So you'll hear a lot of people talk about this. The idea here with natural killer cell testing is that implantation requires a certain inflammatory is an inflammatory event, and it requires some level of homeostasis of inflammatory markers to be at play. And the idea is that the natural killer cell population, which is part of the immune system in all human beings, may be abnormal in patients with recurrent pregnancy loss. So the idea is if you could measure the natural killer cell population in those folks with recurrent pregnancy loss, and if there was a way to rebalance the imbalance in the natural killer cell population, then you would reduce the chances of a subsequent loss. The theory makes sense, but the data to support the theory and the interventions behind it have not proven to be beneficial. So let's unpack that a little bit. First of all, the natural killer cell population in the uterus is one population. The natural killer cell population in the blood is another population. Typically, you'll hear people getting blood natural killer cell levels as a surrogate marker for the uterine natural killer cell levels. And those two cell populations are very different. So what you measure in the blood is not necessarily representative of what's going on in the uterus. So that's one problem. Perhaps before that is it's still not really clear what the natural killer cell population is supposed to be doing in the uterus. So that's problem one. Again, problem two is we don't really understand that the blood natural killer cell population is a good representative of the uterine natural killer cell population. The third issue is that interventions that are thought to bring the natural killer cell population or the autoimmune population into homeostasis, whether that's an infusion of immune cells called IgG or immunoglobulins, or kind of a fatty emulsion lipid treatment called intralipid therapy, the evidence to support those actually causing the uterine cell population to reach homeostasis is not very robust either. And again, those are measured using blood natural killer cell populations, not actually uterine natural killer cell populations. So there are some practices that will talk about natural killer cell testing. I would encourage you to talk to those individuals, figure out if it's right for you, but recognize that there's a lot of controversy about the use of this testing and any interventions related to it. Some folks, they'll do anything. Other folks require a little more evidence to try something. To each their own. Ultimately, it's just important to have some context about these tests.